Yes. Anyway, this is a picture about when that incident happened. I've always been, I guess, a little bit of had a little Superman complex, and that's why I became a doctor, I'm sure. But, you know, it was funny. In that last picture, sorry, my brother is there on the other side of my mom. And, you know, he was always the, troublemaker. You know, he was the one that, got in trouble, barely made it through high school. You know, we get along really well. He's now a Republican state representative back in Missouri. But I always noticed that, when he was, when he would, get in trouble, I'd be like, man, I don't want to get in trouble. So I'd go do the same thing off in the corner and sort of just, never get caught, but do the same thing, right? And that's kind of what I do now in a lot of ways. I just sort of practice medicine at the periphery and sort of get people to think a little and, maybe get in a little trouble. But at the same time, I feel like I'm just spurring on the industry and just sort of, a little bit poking it to just, make it better. So I've always been a little bit of a rebel. In 5th grade, I had this awesome permed mullet. My mom permed that for me. But somehow I did make it to medical school, and I went to Penn State. And then after that, I did a pediatric residency, and then went down to Hopkins to do a preventive medicine residency. And my first rotation was working with this gentleman, which you guys all know, I'm sure. But he has a really wonderful healthcare interest consumer protection group. And preventive medicine is kind of a misnomer. It's not really so much about prevention. It's more about the back end of healthcare. And so this is where I realized that the back end of healthcare is pretty messy. For example, one of the things that I worked on with him was Merck was trying to get the HPV vaccine mandated in the state of Maryland for all 7th grade ladies, 7th grade girls. That was about 3 months after it had gotten approval from the FDA, right? So there's no long-term safety data. And basically what happened was 2 years prior, they got a hepatitis B and chickenpox vaccine mandated, and the punishment was get kicked out of school if your kid did not get the vaccine. So at the same time this bill went up for vote, 10,000 kids across Maryland got kicked out of school. So luckily, we were able to prevent that. It was very interesting, though. I mean, looking at the back end of healthcare, to me, is fascinating. My second rotation was working with this gentleman, Peter Provenos at Hopkins. He's really championing the concept of the surgical checklist. There's 45,000 flights that take off every day, in America, and they don't crash. Healthcare, as we heard, it crashes all the time. And so much of that is due to just lack of standards and routine. So he's very much championing a surgical checklist. And he was the one that taught me that everything is a process, and every process needs to be designed carefully to prevent error. So it was around this same time I started reading this guy. He's Eugene Debs. Anybody ever heard of Eugene Debs? All right. He said, when great changes occur in history and great principles are involved, as a rule, the majority are wrong. And I thought that was really interesting. He's the only guy to run for president of the United States from a jail cell and get more than 5% of the vote. So I decided that I didn't want to be a part of that sort of mainstream healthcare system. I wanted to do something a little different. I did my pediatric residency in New York City. Was down in Baltimore. I was like, I'm going to move back to New York City. And I got really interested in just this old-style doctor, this nostalgic doctor. I was like, you know what? I think I could do that. Now, these pictures are from a day in the life of an old doctor in the late 1940s in Colorado. And this is what he was doing all day long. Giving vaccines to people in the back of their cars, But really connecting with people, getting in their homes, talking with people, communicating, using their phones, and just going home at night and just being, exhausted. But he had this set of tools, And Eugene Debs also said that, whenever these people that change things, the great respectable majority of their day sleep in forgotten graves. The world does not even know they existed. And that hit me really hard because I was like, you know what, I got to do something interesting with my life, So I'm also a photographer. And Many of my friends are creative, artistic types, and I moved back to Williamsburg in Brooklyn, which is like the creative, artistic sort of neighborhood in New York. And my friends would always hit me up. They'd hit me up on email, and they'd send me a picture of like, some rash or something like that. I'd be like, you're probably not going to die, but I'll get back to you on what that is. So it happened so often, that I was just like, there's got to be a business here. So what I did was I started a practice, and this was my practice. I designed my website, and I announced to the world that I'm a new kind of doctor. I mixed the old world with the new world, and what that meant was people would go to my site, and they would see my Google Calendar that I embedded in my site. They would choose a time, tell me their symptoms and their address. My iPhone would alert me. I'd do a house call. You'd pay me via PayPal, and we'd follow up via email, IM, or Skype. Now, what was interesting about this was not only was it a great experience for the people in my neighborhood, which the vast majority of them are uninsured creatives. What was interesting about this was it cost me $1,500 to start, right? My overhead was about 10% compared to a regular doctor's office, which is about 70 to 75%. So what that enabled me to do is right out of residency, start my own practice, hardly any investment, and I got 7 million hits on my website in that first month. Right? Part of that was from CNN and others covering me. This is back in September of '07. But what was great about that was, many of those millions of people that went to my website were doctors. A lot of them were medical students as well. And I talked to a lot of medical students, and I always say, who's the youngest one here? And one person raises their hand and says, I was born in 1990. Right? Like, they're going to be doctors in a few years. And that's amazing because, their brains work totally differently than the 60-year-old primary care doctor that's going to retire next year, the ones who are making decisions for the healthcare system today. So I decided to start something different, new, called Hello Health. And Hello Health, if you can imagine, like Facebook designing an electronic medical record, Many of you probably don't know what health electronic medical records look like. They're pretty ugly. They look worse than Windows 95. Or Windows 8, whichever. I haven't seen that yet. But anyway, Hello Health is a technology, and it's powered by doctors, and they have their own practices. So we had to prove out this technology, so we built our own practice. So that's what this is. It's in Williamsburg. We also had to design the technology, and this is what it looks like. You, as a doctor, have a dashboard, very much like your Facebook feed, to see what's going on with your patients. Who's coming in next, who's emailed you, who's requesting a video visit. It's very much it's just stealing from Facebook and Flickr and applying it to healthcare, basically. So what was interesting about this also, I could add patients to groups. So I could add every one of my patients who have asthma to my asthma group. And if I came across something interesting on the internet, I just fired off a link off to them, and all of my asthmatics would then see, what I think what they should be reading. So we had to advertise this. We put it in, some newspapers. We also, just created messaging that would resonate with the community. And we also put up advertisements in the subway. And I was really happy with this one because, we just put up this, how do we feel today? Just asking an open question to the community. Of course, we got answers, So this is absolutely wonderful. So the MTA and CBS, who runs these ads, made us take it down because we were encouraging graffiti, and then that became a censorship issue, and it got into the news and everything, and it drove a couple more million people to the site. So we were pretty excited about the way we can go out and reach people. But in reality, this is what we're trying to do, right? We're trying to take this old school, complicated, ridiculously complex thing and make it dead stupid simple for you. So after that, I started a design firm called The Future Well. And basically, we were just trying to, I'm sort of a designs-focused person, and not only just aesthetics, but functionality. And we worked with clients like Planned Parenthood, Sanofi, the Freelancers Union in New York City, and just tried to really make them awesome, right? And we did create some wonderful things, beautiful things, and things that really advanced sort of healthcare on the internet, for example. And then they'd take it to the legal and regulatory department and be like, we can't do this. you know? And so that's when I learned, well, you know, it's so hard to go through the system and change it, because the system really, it just doesn't really want to change. And that was pretty sad to me. So it was around this time that I got an email from a friend of a friend. This is him. And he was describing what classic appendicitis in this email. So I was like, oh, God. I forwarded that on to Dr. Goldstein, our general surgeon that I work with. And Evan, Dr. Goldstein, said, send this gentleman right over. So I did. Evan examined him and thought it was appendicitis too, and sent him over to his outpatient surgical center to do a CAT scan. The CAT scan was positive for appendicitis. They set Evan up a room. He was over within the hour to laparoscopically remove this gentleman's appendix, and 3 hours later sent him home on oral antibiotics. So within the span of 6 hours, he contacted me and was home minus an appendix without stepping foot in the ER or the hospital, right? That's amazing from everybody's perspective, right? Now, what that meant was an email just saved about $50,000. Right? Because if he would have gone to a big, massive institutions, the best way to describe them are they're like factories designed to build anything. And if it's a factory designed to build anything, it's going to be highly inefficient and it's going to be highly expensive. So what we did was we sent this gentleman to a very focused factory, one that was designed to just produce a screw, for example. You know, much cheaper, better experience, and higher quality. So that's what we did. And you know, I just thought, this has got to be a business, right? Has to be a business. So what we did was created a company called Sherpa. And Sherpa is in New York City, and what we do is we go into companies. For example, one of our clients is Tumblr, right? So we go into Tumblr and we say, all right, we're going to give your employees 24/7 email and phone access to us, a group of doctors who work full-time manning emails and phones. And you're going to contact us when you're in a bind. We're going to try to solve that problem over email or phone. And if we can't solve that problem, we have a group of about 100 doctors that we know and love and can personally text with in New York City and fast-track you in to keep you out of the ER, to use resources as efficiently and intelligently as possible. And when you do that, you save a ton of money, right? Not only do you save a lot of money, you provide a wonderful, wonderful experience that people love. And so that's really the goal. And to me, it's about the value of a network, right? I mean, the days of the internet, you know, just throwing up like a social network are kind of done. And it's all about creating small, focused, highly valuable networks now that are enabled by the internet and enabled by the way we communicate nowadays. And that's really what we are in Sherpa, is just one really highly valuable, networked group of doctors that are all working on the same team to solve problems for early adopter people. Now, what I think is really interesting about that is, you know, everything great starts with the kids. You know, I mean, if the iPhone was sort of marketed as my parents, it wouldn't have taken off, right? If Facebook was had to incorporate, you know, my grandma, whenever they were also trying to incorporate and get, you know, college students signed up, it wouldn't have taken off, right? So what we do is just connect early adopter doctors and early adopter patients and see what happens, right? So I think it's the future of healthcare delivery. It's just more networked, more human, and I just think more mission-driven. So thank you very much.